Hi, good evening, everyone. Today we have a special guest. His name is Dr. Ahmad Nizar. We're going to speak about abnormal rhythm. Okay, in cardiology, there's a subspecialty that is a group of doctors who are specialized in abnormal rhythm, which we call arrhythmias, and they specialize in the treatment of arrhythmias. And we'll talk more about it by introducing Dr. Ahmad Nizar. Hi, Nizar.
Hi,
How are you?
I'm fine, thank you.
Okay, can you just tell us something about and what is an electrophysiologist job?
Okay. Um, if you liken the heart as a pump, then it actually has both a pump and an electrical circuit. So if you consider a cardiologist as a plumber, then an electrophysiologist is the electrician. So we
Okay.
take care of the electrical part of the heart.
And the electrical part is where it generates the heartbeat, right?
Correct, yes.
So the normal heartbeat is generated by this electrical circuit. But what can go wrong with this electrical circuit then?
Well, you can have two broad categories of conditions. You can either have a heartbeat that is too rapid, or you can have a heartbeat that is too slow. So if you assume that, or we usually take a normal heart rate as between, say, 70 to 100 beats per minute, then anything lower than, say, 60 beats per minute or above 100 beats per minute is considered slow or fast. So that's what can happen to the heart rate.
But
But there
okay, sorry to interrupt you there. But we can also have heart rate that is slow, that is normal, and heart rate that is fast, that is normal in a normal person, right?
I guess that's true. But usually, if you have a normal slow heart rate or a faster normal heart rate, the person usually has very little symptoms. And that would suggest that it's usually normal. But if they are associated with some other complaints or symptoms, then you'll have to consider that it might be abnormal.
So this whole slow heart rate is generally termed as bradyarrhythmias,
Hmm.
and
Correct.
the heart rate that's fast is called tachyarrhythmias. But the heart rate that's fast, for example, can also be caused by anxiety, fever, or even simple things like thyroid problems, right?
Yeah, I guess so. Generally, we have to realize that our heartbeat can vary to the demands of the body. So, in situations where there is an increased demand, it is expected to increase. In times when there is a reduction in demand, it's expected to slow down. Just for example, when you're asleep, it tends to slow down. And it's not unusual for heart rates to drop below 60 beats per minute when somebody is asleep, actually. So if a person is anxious, the heart responds to that by increasing its rate. Um, so it is natural for the heartbeat to vary in a person. But when it's abnormal, it can be out of context of the situation. For example, a person can be resting, yet the heart rate can be much faster than expected, say 150 beats per minute. That would be unusual. And
What
yeah,
what are the most common causes of this um, high rapid heart rate?
the commonest cause would be something natural. Exercise, for example. When you exercise, right? Um, and when your temperature rises, it increases as well. If you're dehydrated, that's not a normal situation, but your heart rate tends to respond to that by increasing. It naturally tries and compensate for the situation, actually. So our body is automatic. It tends to try and adjust, and the heart rate is one of those things that can be adjusted. It can go high, it can come down.
And what are the diseases that are really associated with the rapid heart rate?
In rapid heart rate, you can have just primary electrical disease. There is nothing physical, but there are problems with the electrical system in the heart. So this is a broad category actually. While others may have underlying heart disease that may actually promote abnormal heart rhythms. Let's say, for example, you're having a heart attack and you might actually present with a very rapid heart rate that might actually go on to lead on to cardiac arrest. So if you broadly divide them into these two groups, the primary electrical disease, you can have actually a condition where there is abnormal pulse formation and as well as an abnormal pulse conduction. You mentioned the heart has got, I mentioned that the heart has got a electrical circuit. There is also a pacemaker in the heart. So there's a specialized group of cells in the right upper chamber that tends to have this ability to dictate the heart rate of the heart rate basically. It usually beats 70 to 80 beats per minute at rest. So if there is impulse formation abnormality, your heart rate can either go fast or go slow. On the other hand, you can have abnormal circuits within the heart. The normal circuit is a one-directional circuit from the right upper chamber, spreads to both upper chambers before it crosses a relay station, and it then goes down two wires to the right and the left, and it goes only in one direction. But you have some conditions that may actually develop short circuits within the heart. You may actually develop rapid heart rate that is due to abnormal conduction. So
This circuit that they were talking about, okay, let's just demonstrate again. Okay, so this, let's say this is the wire,
right.
Okay, and it starts from here, means it generates electrical impulse down here. So this is one way. Okay, and normal heartbeat is generated from here down all the way, and then when you reach the end of the wire, it will beat one time.
Correct. Yes.
Okay. So
because
if it beats like 70 times per minute, means this electrical impulse starting from here will then generate 70 times per minute.
Correct.
Now you're telling us that there is an extra wiring that may happen like this, and it's going down round in the circuit.
Correct. Yeah, you can get a normal circuit like that.
So these are called SVTs, right?
The one that is primarily electrical in nature is SVTs, or you may have ventricular tachycardias or VTs as well.
So the circuit can be many, yeah, depending on where it is.
Correct. It can involve just the upper chambers, or it can involve the normal conduction system, and therefore may actually spread throughout the heart, but yet it's called SVT.
Okay, the problem with this abnormal rhythm, right? They come and go, right? They don't always stay there.
Yeah.
Okay, how do you actually capture this abnormal rhythm? How do you make a diagnosis before you can tell the patient this is what you have? Because sometimes they have it at home 5-10 minutes, and then they come to us and the ECG is absolutely normal.
Well, the symptoms is a bit specific for people with abnormal heartbeats, particularly when they have this abnormal circuit. It tends to happen suddenly, and then it will raise, and the tendency is for that rate to be pretty regular. So it's rapid and regular. And when it stops as well, it tends to stop suddenly. So the rapid onset, rapid and regular rate of the rapid heart rate, and then when it stops, it tends to stop suddenly, gives you a clue that there is this short circuit within the heart. But the only way to make a diagnosis of somebody with such a problem, they will have to have an ECG recorded. That is a test where we try and see what is going on in the electrical system of the heart. It's a simple test. It's painless. We put electrodes on the chest, and we have 12 electrodes, 12 leads altogether, so that we can observe the way the electrical current actually moves, and it will be able to give us very important information with regards to where the origins of this, what type of rapid heart rate it is, and which ventricle or which chamber is it involving. Sometimes you may be able to tell where the extra pathway is as well, where the circuit is from the ECG. So it's very important to try and record that ECG.
But if let's say the patient has it maybe once a week or maybe every 2 weeks, and then how do we then I capture it when the patient is, let's say, at home or shopping? They're not actually doing the ECG. What are the options that they have for investigations?
Well, you still need to record the ECG, but that's the problem when the episodes are infrequent, or they may be, maybe it happens like a once a week sort of condition. If it happens every day, for example, then you can do a 24-hour ECG recording, which is what we call Holter. But if it doesn't happen every day, we can actually try and record more than 24 hours these days. We have devices that can be left on the chest and it records your ECG for up to a week. So that's possible.
So you wear the ECG for a week. How do they bathe and all that?
There are these devices now that looks like a plaster or a patch.
Mm-hmm.
And in that patch, there is a small detector which acts as a recorder as well. So if you place it on your chest and it's plastered onto your chest, you can take a bath every day and it still will stick there. It can be left there for a week, and it will be able to record your heart rate for that 7 days.
How useful is the Fitbit's watches on recording rhythms?
The problem with Fitbit, and I heard, for example, they only record it gives you a digital sort of display what your heart rate is. It doesn't actually record the ECG itself. However, I heard that the
Apple Watch?
iWatch,
Yes, the Apple Watch.
it's possible to record ECGs, but that's an expensive way of actually recording ECGs, though.
But apparently, the Apple Watch, the recording can only be sent when you are in the US. It does that software. I mean, the gadget doesn't work here.
Right.
It's very important to get the ECG, right?
That's right. That's the way
To
that
make
you.
a diagnosis.
There are the things that we can do. There are, well, they're not inexpensive, but they're cheaper alternatives. There are devices that people can purchase on the net or even in the shops, for example, which can actually record your heartbeat for about a minute or so. But it's small enough for you to be able to carry it all the time with you. So when the actual abnormal heart rhythm occurs, when you feel symptoms, you can record them and send them, say, over the internet, over email, for example, as a PDF document. And you can actually do that. That's another way of doing it. And then even more than that, you can have actually devices that can be implanted in you. So these implanted devices are small. They don't require any major surgery. In fact, it can be done as an outpatient procedure in the clinic. It's actually placed in the chest. So it's placed under the skin in the chest, and it will be able to have enough memory to record usually about 6 loops. And that 6 loops will be in a case of as it enters the loop, the last loop will be replaced by a newer loop. So if they have 6 loops that is recorded, the first loop will be dumped while a new loop is recorded if all 6 are filled. But the device is pretty good because you can trigger it. If you feel any symptoms, you can trigger it. And if you have any symptoms that are particularly serious, for example, associated with you losing consciousness, this device are going to be helpful because it will record the abnormal heart rhythm. And then you can come to the hospital. We can actually talk to the device and see what is actually causing your symptoms on an ECG that is captured in that device. So that's called an implantable loop recorder. It can last for up to 3 years actually these days.
Wow. Okay, we're talking to Dr. Ahmad Nizar, and we're talking about abnormal rhythms. We are at this point of time talking about abnormal rhythms that are rapid and when the heart is normal. Means we basically have no other problems but just rhythm problems. And what are the symptoms of patients with this rapid heart rate other than palpitation?
The palpitations, there are 2 different types of palpitation that you probably will have to pay attention to. The regularity of the palpitation may point to a different diagnosis. So if you have a rapid and regular rhythm, then it means something. But if the rhythm is very, very irregular, it's chaotic, then it means something else. So that's an important thing to note when you have any palpitation.
So when you have a palpitation, you can actually feel whether it's regular or irregular.
Yes, you should
Patients
be.
can feel it.
Yeah, you can actually feel it because there are the feeling will be different. A regular pulse is if you actually feel a regular rhythm beat, you can tell the difference between say again a chaotic beat to a regular rhythm beat actually. So that's important to note. The other symptoms are, I guess, what's important is what are the serious symptoms that you have to know. The first thing would be if you develop symptoms like dizziness or near fainting spells. That would be alarming actually. You should present yourself to the hospital if you do have those symptoms. The other would be if you have chest pain with your rapid heart rate. That might mean that either the rate of the abnormal rhythm is very rapid, or you might have underlying disease that might actually cause chest pain. The other would be associated symptoms like breathlessness, leg swellings. That's right. Signs of heart failure, meaning that the heart cannot cope with that rapid heart rate. That is actually quite serious as well. So if you have these symptoms, along with, let's say, a family history of sudden death, then it makes it very, very important that you present yourself. So those are the symptoms that would be something that will trigger your attention so that you present yourself to the hospital sooner than later.
Okay. There was a question because I presented a live chat about a week ago, and there was a question. This gentleman said that I can't remember his name, but he had ventricular ectopics, and about 39% of the time he had these ectopics. Would that mean that he needs further treatment for it? You know?
Well, that's interesting because for some people, if you have, let's say, this extra beats that occurs frequently, right? Um, there are some people who it may mean nothing at all. It's just extra beats that may occur 1% in a whole day and may not actually do anything that might be detrimental to the person. But on the other hand, if you have underlying disease or associated disease, for example, you had a previous heart attack, or your heart has been weakened by some form of valvular disease or some infections before, um, those extra beats may actually mean something. It might increase your risk for sudden death. So it depends on the underlying heart disease that you present with when you have extra beats. So if, let's say, the whole heart is normal, all they present is just this extra beat, because that
Huh?
can be a condition where there is abnormal impulse formation. So there are extra beats that can occur frequently. The frequency of the extra beat may be something that you should worry about. Let's say if you have 100,000 beats a day, and usually our normal day would be 90 to 110 to 120,000 beats. If the percentage of these extra beats make up your normal heartbeat is high, let's say 40% and above, it's quite likelihood even these extra beats may actually cause the heart to weaken. So the, the, this condition is called tachycardia-related cardiomyopathy. So it sort of changes the way the heart beats, because the normal heart has got the system where it starts from the top and it goes in one direction. If your extra beats were to occur from another side, as let's say the lower chamber, and it occurs frequently enough, it may change the way the heart contracts, and it actually can cause the heart to weaken as well. So extra beats that are frequent can be detrimental, and it may require treatment. If, let's say, for example, now you can see these changes occur even in people who have 40% and 30%, up to 5% or so. If you have, let's say, the numbers though would differ. There are lesser people with this extra be like 5% that develop tachycardia cardiomyopathy, while if you have a higher percentage, like 40%, the higher the chance that you may develop this problem actually.
Now we have a whole group of course, patient diagnoses that we can, or diseases that's associated with rapid heart rate. Okay, we have already identified SVT. We have already identified ventricular ectopics, and then we also have atrial fibrillation, which we have not spoken about. And we will take this question from Natasha Patrick. She said, "Hi Betty, does hyperthyroid cause irregular heartbeat? And if it's treated, would it get better?" Okay, I think she is talking about atrial fibrillation. So yes, hyperthyroid does cause irregular heartbeat, and it causes atrial atrial fibrillation. And sometimes when maybe you can tell them that how atrial fibrillation begets atrial fibrillation. How once you start having atrial fibrillation, if it's not treated fast enough or reverted to the sinus rhythm, how it will continue to be in atrial fibrillation.
In people with thyrotoxicosis, that is overactive thyroid, there's two ways that they can develop atrial fibrillation. One is where the thyroid disease itself may cause changes to the heart. They may develop cardiomyopathy from thyrotoxicosis. In that situation, they can develop this atrial fibrillation. On the other hand, when you have an overactive thyroid as well, it can cause the rhythm of the heart to become chaotic and spontaneously develop atrial fibrillation. Generally speaking, if you were to treat the underlying cause, because this is one of the reversible causes of atrial fibrillation, you may be able to get rid of the atrial fibrillation itself. While if the changes were to occur to the heart, let's say, for example, you develop cardiomyopathy, then the atrial fibrillation might persist, even if you treat the thyrotoxicosis. So it depends on how much damage has been done to the heart, and what is the likelihood that the damage can be reversed, or if it's mild, for example, your atrial fibrillation can still settle. But the commonest arrhythmia is atrial fibrillation. About 2% of the population, as we grow older, develops atrial fibrillation. So it's said that by the time we reach the age of 50 and above, 25% of the population, your risk of developing atrial fibrillation is about 25%. And when you reach the age of 80, about 20% of those populations surviving will develop atrial fibrillation as well. So atrial fibrillation is a very common cardiac arrhythmia.
Is it a life-threatening condition when you have atrial fibrillation?
Per se, directly not due to the arrhythmia, but what the arrhythmia can cause. Because in atrial fibrillation, you don't have an effective contraction of the upper chamber. The heart is fibrillating, which means it's chaotic and there's no effective pump. So the upper chamber become a passive conduit. And as a
Nizar, we have to stop you here because we're talking to the public now. Nizar is very used to talking to doctors, so he used terms like the upper chamber, and okay, this upper chamber is actually one of the rooms of the heart, the smaller rooms. Okay, so it contributes some amount of the heart output. Means when the heart pumps, mainly it's actually the main chamber, which we call it the left ventricle. But when in normal heart, even the small chamber contributes to the cardiac output. So when you have atrial fibrillation, that small chamber, that small room, then doesn't contribute to the heart cardiac output. Okay, so that's what the Nizar is saying. So atrial fibrillation is the commonest, one of the commonest arrhythmia we see, and it's not, so far we know that it's not life-threatening, but it has a lot of it may complicate things. Like
what it can cause is actually for blood clots to form in the cardiac chamber, particularly the upper chamber, the atriums of the heart. And this blood clot can actually travel with the blood. And if it goes to particularly the brain, it can give you a stroke. And a stroke is quite a debilitating condition, actually, because the tendency for people with atrial fibrillation, they tend to develop large stroke because the blood clots tend to be pretty big. So that's the danger of atrial fibrillation. The other danger of atrial fibrillation is if you have an uncontrolled heart rate. In people with atrial fibrillation, their heart rate can be very rapid. It may be usually above 140. It may even reach 180 beats per minute. So if this heart rate persists for very long periods of time, it can damage the heart. The heart can become weaker, and it may cause heart failure as well. Same thing like the extra beats, it causes tachycardia cardiomyopathy.
okay, so tachycardia. Okay, other than atrial fibrillation, like the general tachycardia, what can we do to treat this tachycardia? Like SVT or when this circuit, that this extra circuit, what can we do to treat it? Because there's a person who says, how do we get irregular heartbeat back to normal? I think that's quite a general question. So we can get the heartbeat back to normal with, of course, medication. Sometimes in atrial fibrillation, we can give medication through the veins to get the heartbeat back to normal. We can use oral medication to get the heartbeat back to normal. But we have abnormal heartbeat that can be very disturbing to the patients, like SVT. Sometimes they travel and then they get it, and the heartbeat is beating like this morning. Our patient, the heartbeat was 198. So, how do we then treat these patients with abnormal circuit and tell them how easy the treatment is?
Potentially, there is a cure for such conditions, especially in terms of atrial fibrillation, SVTs, and some form of primary electrical disease in the ventricles as well. There is a way of curing them, and but it requires a procedure. So if there is a problem with impulse formation, there is a rapid focus, then we use catheter procedures, which means we go through arteries and veins and enter into the heart chamber itself. And we search out the focus where this abnormal heartbeat is formed. And we can actually use either high temperature or cold temperatures to destroy the focus. Now, if it is an impulse conduction problem, or then what you need to do is to identify the circuit, and you look for the areas where the circuit passes through narrow channels. And if you can identify those narrow channels, you then can apply this energy, whether cold or heat, to actually block the path of the electrical circuit. And then you can actually get rid of it as well. So potentially this procedure that we call radio frequency ablation is a curative procedure. That is the main way to treat cardiac arrhythmias these days.
And
Now,
they're not operations, right? They're just procedures, right? Patients doesn't need to undergo the risk of general anesthesia. Okay, it's just all done locally. Maybe they're sedated a little bit, and it's a day admission, and
Yes.
usually lasts about 2 to 3 hours. The procedures.
If we're talking about SVT, yes, we generally do it under sedations, and it's a procedure that can go over 2 hours. And they generally come in the morning. We do it in the afternoon. They go home the next day, and usually they'll be up in about 6 hours after the procedure. So it's very a quick turnaround, and it's just a tiny punctures that we put in the groin to get access into the heart. People have heard about coronary angiograms. It's very similar procedure. We just put catheters through veins and arteries to approach, to get access to the heart and the focus.
Let's take some questions. Diva Haran asked, what food to avoid if you have arrhythmias? Not all arrhythmias are related to food, right?
Yeah. Well, most arrhythmias are not related to food.
Yes.
But food can be something that aggravates arrhythmias. Let's say coffee. Coffee is known to be a cardiac stimulant. And therefore, if you have cardiac arrhythmia, you might actually either increase the likelihood for the short circuit to start, or you may actually increase the number of triggers that actually will trigger the rapid heart rate. So coffee is obviously something that you want to avoid. Alcohol is the other. Alcohol, in the West, it's well known that if you go on a long weekend binge, you might end up with atrial fibrillation on the Monday following the weekend. So that's a well-known.
It has never happened to me, so I guess I've not binged enough.
Probably.
Okay.
I've had patients before, who presented with dilated cardiomyopathy, and he was a teacher, and he says during the school holidays he spends his time making this, I guess, what do you call that? Their home brewed alcohol. So they brew the alcohol from rice, right? So they spend
Moonlighting, moonshine. Okay, go on.
he says after once they have made their brew, they will drink until they get drunk, and then when they wake up, they drink some more.
It doesn't sound like they get hangover at all.
So imagine that.
Alcohol-induced dilated cardiomyopathy.
Yes, you can. But I suspect you can be a direct effect of the alcohol, the ethanol toxicity, or it may be due to arrhythmia induced, cardiac tachycardic cardiomyopathy actually.
Okay, and Sharon Shu asked, if the heart rate falls to 48 while sleeping, is it too low? I think we spoke about the heart rate being very slow sometimes during sleep, right? So it can be normal. And then Ping Tang asked, she had ablation done for atrial fibrillation. And in the past 2 years, she didn't say when she had it done, but past 2 years, he, she still get irregular heartbeat on and off, particularly under stress or anxiety. Is this normal or regular? It could be related to the anxiety in itself, right?
Yeah, it might not be the atrial fibrillation,
Yes.
or it might be focuses that might still be persistent, but at least the atrial fibrillation is not sustained. That's something um, that may be considered partially cured.
And then Mr. Cheong Kai Kong said, can cardiomyopathy be reversible? And then not all, but if it's tachycardic induced, then it is reversible when you control the heart rate and you can actually improve on your heart function.
If you
So,
catch early enough and you can get rid of the cause, the tachyarrhythmia, and stop that from coming back, then obviously it is reversible. But there might be a stage where we always worry about this, that there might be a stage where the arrhythmia has damaged the heart to the point where you cannot reverse it. But so far, through my
yeah.
experience, they're generally reversible.
Yes. Again, Melissa asks whether when she runs up the stairs, she gets shortness of breath. Is it normal? I think we don't know her age, so it's difficult to say. Or heartbeat beating faster when feeling anxious. Yes, it is very normal. When we are all anxious, we get palpitation, or the feeling that our heart is beating faster. But sometimes it may not, but the feeling is there. It is very normal to get shortness of breath when you climb up the stairs if you're not fit. Every exertion, every exercise is different. Sometimes you may be able to run flat for a while, but when you climb up the stairs again, it is different. So yes, I think it may not be related to any heart problem at all. Now we have spoken about tachyarrhythmias. Now we need to speak about slow heart rate. My
Okay.
number one question is, okay, sudden death in athlete, is it due to slow heart rate?
No. Sudden death in athletes are more commonly due to fast heart rates.
Okay.
Uh, so it's a tachycardia, it's a rapid heart rate, and usually it comes from the ventricle, the lower chambers. So it's called ventricular tachycardia in that sense. Um, there are certain conditions that might predispose you to this abnormal heartbeats. These are actually structural heart disease. So they may have conditions that they were born with. There might be something that can be congenital. So a person who is involved in sports, maybe professionally, they usually would have to undergo a certain uh, pre-medical so that they exclude all these risk factors, these conditions that might predispose them to sudden death. A lot of those sports people who die suddenly or they have a cardiac arrest,
Mhm.
they have this sort of problems, either this condition called hypertrophic cardiomyopathy or another form of cardiomyopathy called RV dysplasia. Uh, Pretty common in the West, not so common here actually.
Oh, so meaning that being an athlete in itself doesn't increase your risk. It
No.
is, yeah. So that's what I want to try to say. So now we'll talk about bradyarrhythmias, but bradyarrhythmias are less present less likely, right, in our practice
Yeah,
compared to tachyarrhythmias.
there are there are two groups that we see bradyarrhythmias. Primarily, if it's just electrical disease, then is the elderly. They have a condition where their own pacemaker may no longer be viable or functioning normally, so it slows down. And then there is this condition where there is a conduction blockage. The connection between the upper and the lower chamber may be actually blocked. and therefore the lower chamber is not receiving the electrical impulses from the upper chamber, and it slows down because there is a hierarchy in the rates that is produced by specific areas in the heart. So the pacemaker that is fastest lies in the right upper chamber. Then the second, probably the next fastest, is between the two, and usually they are ectopics. But the next fastest would be the relay station called the AV node in the middle of the heart. And then after that is those two bundles that goes to the right and the left may produce impulses as well. But if the normal pulse is 70 to 80 beats per minute, if you're depending on your impulse formation from the ventricles itself, it might just be less than 40 beats per minute.
Okay, let me just simplify what Dr. Ahmad Nizar has been saying. Okay, basically, there's a wiring system in our heart. Okay, and when this wiring system becomes faulty, mainly because of our aging. Okay, okay, let me start again. So there's a switch here, and then it goes down all the way. But actually, this is simplified. Along the way, there is another switch here, which we call the AV node. Okay, so imagine this as the electrical pathway in our heart. Okay, now as we age or anything that grows old, it becomes faulty. So this is an electrical wire. So the fault can be here, means where it generates the electrical impulse. It can be here, where there's another switch called the AV node, or it can be generally along the whole electrical wiring. Okay, this is how we get bradyarrhythmias. So what are the treatment that we have for bradyarrhythmias? Unlike tachyarrhythmia, we got drugs.
Correct. In this situation, we have to rely on pacemakers. We need to replace what is lost. So either we replace the pacemaker itself, that is the site that actually produced the impulse, or we create new channels. Through a pacemaker, we can actually form a normal conduction as well. So we need a pacemaker.
So pacemaker basically is like a battery, and then attached to a wiring system that goes into your right side of your heart. And when the heartbeat becomes less than, let's say we set the pacemaker at 60, means when your heartbeat becomes less than 60, then the pacemaker will take over. It is a very simple procedure. The pacemaker is actually like a battery, and it's the size of maybe a 50 cent. Yeah. Okay. And a pacemaker is then placed under your skin. You need a minor surgery. You won't remember the surgery because we will give you some sedation. And again, it's a day. It can be done as a daycare actually, a pacemaker. Yeah, usually we will let you stay a day. The pacemaker has two kinds. One is what we call a single chamber, and second is a dual chamber, means we have two wiring or a wiring. It's very specific. But other than that, other than pacemaker, we have new techniques. Micro? Yeah, that is to also help your heartbeat if your heartbeat goes too low. It is quite technical. It is very difficult to explain, actually, right? Without illustration.
Well, it looks like a small, tiny bullet, which consists of a computer and a battery.
Yeah, very tiny bullet.
Very tiny bullet that we actually place in the chamber of the heart itself. So it's got hooks at the end of it to hook into the heart muscles, and it's left in the heart chamber itself and act as a device to pace the heart. It can detect the heartbeat, and it can pace when it's necessary, actually.
Okay, we take another question from Sarojini. Can a person with asymptomatic right bundle branch block found from ECG cause problem in the future? Usually not.
70% of people with right bundle branch block are normal, actually.
Yeah.
There are
Yes.
the 30% that you will need to exclude things like a hole in the heart that might usually occur in people with right bundle branch block. But otherwise, 70% of people are normal.
Yeah. So right bundle branch block is very, very common, abnormal finding, but still coming from a normal heart most times.
It's different if it's left bundle branch block. That's different.
We have spoken for 45 minutes, and I think we basically have covered just about everything, right? Tachyarrhythmia, bradyarrhythmias, treatment, symptoms. Um, so to recap, actually we have two types of abnormal rhythm, the fast and the slow. Okay, both are easily treated. Both can present the same symptoms except palpitation, right?
Yeah.
Loss of consciousness, shortness of breath, um, lethargy. But the fast heartbeat usually will cause palpitation. You can have abnormal heartbeat with a normal heart. It's very, very common. Okay, and it's all very easily treated. Okay, we just need to identify your abnormal heartbeat. Once we have identified, we can make a correct diagnosis and then we can actually suggest the best method of treatment. And in arrhythmia, it's very good because most times it's curable, especially the extra pathway kind of. So if there's no more questions, we will say goodbye and thank you to Dr. Ahmad Nizar. I'll see you again
Great.
next week. Tomorrow I'm discharging the patient, and then we'll see her next Wednesday.
Okay.
We're
All right.
talking about our patient now. Yeah. Yes. So I'll send her to your clinic also next Wednesday. I
Okay.
spoke to the son. Okay. See you then. Bye.
Thank you. Bye-bye.
Okay, thank you for tuning in. I'm very happy that Dr. Ahmad Nizar gave us a very, very comprehensive, um, you know, layout of what could go wrong with the electrical impulse and the electrical wiring in our heart and how easy it is to treat it. So I'll see you again for the next live chat. See you then. Bye.